Welcome to a special edition of the Sunday Rant by Dutch Rojas. Remember, this video is unedited. I have a limited amount of time. I barely have time to put on my shoes, which is why I wear loafers. I'd show them to you, but then you'd probably see my shorts. Okay. First, I'd like to say thank you, a big round of applause to the frontline healthcare employees, all the way from the nurses to the physicians and all the wonderful clinicians in New York City. You guys are doing a killer job. It is the governor, it is the employers that you work for that suck. Now, that doesn't mean that Governor Cuomo sucks overall. You know, English is my second language and I understand these things, but you guys write in and say, well, if you criticize them, that means you don't like them. Well, no, it doesn't mean that at all. It doesn't mean that at all. What it means is that I don't like a certain action. Just because I argue with my better half doesn't mean that I dislike her. I'm madly in love with her. So, back to the thank you. Thank you to the frontline people. Thank you for doing the job. Thank you that even though your pay's getting cut and you're getting jerked around, you're still doing the work that's required. Taking care of patients first. Now, I saw on the bunch of you sent me the ask a website information and then more information about surgery centers. What are we doing? How are we doing? A lot of surgery centers are offering to help the health systems. The health systems don't want the help. Why? Because they're jerk-offs. But other than that, it is a Sunday special edition. Other than that, they don't want any help from anybody because they want to keep the income. They want to keep the revenue. And who's they? It's the owners of the health system, the people on the board. You know, the one Eric talks about that says, we don't want doctors on the board and we don't want nurses on the board. Now, what are private practices doing to fight back? Well, a couple of ideas have been floating around. One is a lot of you want to get engaged in the futures market. Good. Good. I think we can sell 3, 4, 5 million procedures in the next 6 months using our futures market. Right? We'll price them September through December 31st. Employers will buy them and we'll move them forward. And we're seeing that happen contractually. You guys are emailing us, info@sanosurgery.com, and we're seeing the transactions happen. Now, the other thing that I'm seeing that I really, really like, you ready, is that physicians and clinicians are working together. I'm seeing much less of the infighting between nurse practitioners and doctors. I'm seeing much less fighting between physicians and PAs. You know, everybody has an ego, but it's time for the egos to drop. There's no need for it. It's worthless. You studied what you studied, you got the degrees you got, and do the work. And if you can do the work, do it. In the Marine Corps, look, it's a pretty similar example. I don't care if you were a PFC, private first class, and you could do the work of a sergeant, and you were in the fire team and you had to do the work, you did the work. And that's the way it goes. I don't care what rank you are. I don't care if you're a stupid lieutenant or a captain. If you can't do the work, you're out. And that's the way it goes. So, it doesn't matter to me who it is, as long as the job gets done. And it gets done right. And it's on your rear end if it doesn't. See, we're moving to an outcomes-based system. I don't know what all the data components will be. That's for people far smarter than myself. But we are moving to an outcomes-based system. And it'll be you that has to answer, not anybody else. If you're a nurse practitioner and you think you can do the work and you treat patients and you're like, hey, I've been doing this for 30 years and I'm really good at it, I believe you. You'll have to answer. So will PAs and so will doctors. Doctors have long gotten away with fee-for-service. Hey, sorry, your knee didn't work. Now, mostly, that's been backed by the health systems. Right, and I don't want to get off on a tangent about how much I dislike the health systems. Because I like them for what they're doing for COVID patients. I like them for what they're doing for chronic issues. I like them for lots of reasons. But I despise them for many others. So it's really a love-hate relationship, if you get what I'm saying. All right, finally, besides my thank you, besides talking about futures, I'd like to give you one more thing to think about, one more thing to consider. If private practices are being decimated, which they are, I've got more calls in the last 2 weeks than I've gotten in the entire 20-year history of doing this. My LinkedIn box is flooded. Our employees are flooded. Like, I don't even know what to do. I told my better half the other day, I've never ever in the history of my business career gotten over 500 emails in a day. I don't even know what to do with it. But here's the answer. Here's why I rant about physicians and nurses and their cooperation along with PAs. Is the answer moving forward are physician-owned facilities. That's the answer. But physicians are going to have to work out with nurses. They're going to have to work out with PAs how they can also have equity ownership. Because I'd rather have nurses, PAs, NPs, and doctors fighting against private equity, fighting against the bankers, fighting against the pension funds. I'd rather have that than the system we have today. Don't forget it. If you want to save your rear end, you want to build good capital. You think bankers bankers want doctors to be involved? They want nurses to be involved? You know how persnickety nurses can be? They're on your rear end about everything you don't do right. I mean, half the patients in the country aren't compliant about anything, whether it's medications, I think that's 65%, or surgeries, 40%. They don't listen. I mean, a DPT will tell you what to do post-surgery, and I have friends that go, God doesn't know what he's talking about. I mean, are you a complete doofus? Of course they know what they're talking about. They went to school for 15 years while you were partying and having fun. I mean, right down the street from my house is one of the largest party schools in the country. They don't even study. They borrow money to party. It's insane. Listen, you ought to consider listening when a DPT says something to you. You ought to consider listening when a persnickety little nurse says something to you. Why? Because they know what they're talking about. They know what they're doing. It's time to return back to a healthcare system run by nurses and physicians. Not by bankers, not by insurance executives, not by lawyers who went to third-rate schools, or even first-rate ones. I don't care where they went. They're not doing the job. Tomorrow, we're going to have a discussion about Medicare for All, because people can't stop emailing me about it. It's the dumbest plan of all time. All it does is protect Americans. Now, most people who believe in Medicare for All will tell you that they're global citizens. And yet, they want to just protect themselves. They don't really care about their neighbor, because if they did, they'd build a system based on competition and free enterprise. Nurses, doctors, get your shit together, cooperate, and beat the daylights out of these freaking bankers. Rojas out.